My grandmother had all her teeth at 81. Not most of them, all of them. No implants, no bridges, no partial plates. Her own teeth, intact, functional, until the end of her life. I didn't think much about this when I was younger. I assumed it was genetics. Good luck. Something that had nothing to do with what she did or didn't do. Then I started paying attention to what she actually did with her teeth every day. And I found something that has been sitting in plain sight for 70 years. A set of daily habits that cost nothing, that take about 4 minutes total, and that the American Dental Association and independent dental researchers have been quietly recommending variations of for decades. Not one of these habits involves an electric toothbrush. Not one involves a whitening strip. Not one involves a prescription mouthwash or a specialized toothpaste with 17 active ingredients. They are all things that cost nothing or almost nothing. They all have a mechanism that explains why they work, and they were all completely normal to every American woman in 1952. This video is those habits. What was different about 1950s dental health? Before the habits, I want to put something in context because it changes how you understand everything that follows. The 1950s had worse dental technology than we have today. No electric toothbrushes, no water flossers, limited fluoride availability in most municipalities, far fewer specialized dental products. And yet, the data from the NHANES health surveys, the National Health and Nutrition Examination Survey that has tracked American health since the 1950s, shows something counterintuitive. The rate of complete tooth loss in older Americans has declined significantly since the 1970s. But the rate of cavities and gum disease in middle-aged adults has remained stubbornly persistent despite the explosion of dental hygiene products in the same period. More products have not produced proportionally better outcomes. What has changed between 1952 and now is not access to products. It is diet, stress levels, mouth breathing patterns, and the specific daily habits that were simply how oral hygiene worked before the dental product industry created a more complicated and more profitable version. The 1950 seconds woman's dental routine was not primitive, it was efficient. And efficiency in dental health means doing the right things consistently, not doing more things expensively. Habit 1. Oil pulling with whatever was in the kitchen. My grandmother started every morning with a tablespoon of oil. She swished it around her mouth for 10 to 15 minutes while she did other things, made coffee, set the table, opened the curtains. She called it rinsing. The practice has a much older name, oil pulling, and a history that predates dentistry as a profession by thousands of years. But the reason it works is not ancient wisdom. It is chemistry. The bacterial populations in the mouth, including Streptococcus mutans, the primary cause of tooth decay, and Porphyromonas gingivalis, associated with gum disease, have lipid-based cell membranes. Oil is lipid-soluble. When you swish oil around the mouth for an extended period, the bacteria physically adhere to the oil through lipid-lipid affinity. When you spit the oil out, you remove a significant portion of the bacterial load from the oral surfaces. A study published in the Journal of Indian Society of Periodontology compared oil pulling with sesame oil to chlorhexidine mouthwash, the clinical reference standard for bacterial reduction, and found comparable reductions in Streptococcus mutans counts in plaque and saliva. Chlorhexidine costs money and stains teeth with extended use. Sesame oil or coconut oil costs a few cents per session. My grandmother used whatever oil was in the kitchen. Olive oil mostly. She had no idea what Streptococcus mutans was. She knew that this was how you started the day. Habit 2. Baking soda for cleaning, not commercial toothpaste. Once a week, sometimes more, my grandmother cleaned her teeth with baking soda. Plain sodium bicarbonate from the kitchen, on a wet toothbrush, 2 minutes. Baking soda has been used as a tooth cleaner since the 1800s. The mechanism is physical and chemical simultaneously. The mild abrasiveness of sodium bicarbonate particles mechanically removes surface staining and plaque biofilm from tooth enamel, more gently than many commercial toothpastes, which use calcium carbonate or silica abrasives at higher concentrations. The alkalinity of baking soda, pH approximately 8.3, neutralizes the acidic environment in the mouth that bacteria require for enamel demineralization. Tooth decay requires acid. Bacteria produce acid. Baking soda neutralizes the acid. The mechanism is direct. A Cochrane systematic review, which is the gold standard of evidence-based medicine, found that baking soda toothpastes were more effective at removing plaque than non-baking soda formulas. More effective, not equivalent. More. My grandmother's baking soda box cost less than $1 and lasted months. The specialized whitening and remineralizing toothpaste I was using before I changed my routine cost $8 and lasted 3 weeks. I now use baking soda 3 times a week and a plain fluoride toothpaste the other days. My last 2 dental cleanings have had the same comment from my hygienist: significantly less buildup than before. Habit 3. Tongue scraping every morning. My grandmother had a small silver implement on her bathroom shelf that I never understood as a child. Long and slightly curved, with a thin, flat edge. I thought it was a hair tool of some kind. It was a tongue scraper. Every morning after the oil pulling, before anything else went into her mouth, she used it. 1 slow pass from the back of the tongue to the front. Rinsed the scraper. That was it. The surface of the tongue is covered in papillae, small projections that create surface area where bacteria, dead cells, and volatile sulfur compounds accumulate overnight. These volatile sulfur compounds, hydrogen sulfide, methyl mercaptan, are the primary biochemical cause of morning breath. They are also associated with elevated bacterial load in the overall oral environment. Brushing the tongue with a toothbrush disrupts the biofilm partially, but the papillae trap material between them in ways that brush bristles cannot efficiently remove. A scraper physically removes the accumulated layer rather than redistributing it. A study in the Journal of Periodontology found that tongue scraping reduced volatile sulfur compounds by 75%, compared to 45% for tongue brushing. The silver implement on my grandmother's shelf has been used in Ayurvedic medicine for oral hygiene since approximately 500 BCE. The American Dental Association has recommended tongue cleaning as a component of complete oral hygiene since 2017. Subscribe and leave a like if you just thought of buying a tongue scraper. The bell means you'll catch what comes next. The diet connection nobody talks about. I want to step back here and talk about something that I think is the most important factor in dental health, and the one that has changed most dramatically since the 1950s. The 1950s diet was low in ultra-processed food. Not as a choice, as a circumstance. There were no chips engineered to be impossible to stop eating. No flavored drinks designed to be consumed throughout the day. No sticky processed snacks that coat the teeth in fermentable carbohydrates for hours. Streptococcus mutans, the main cavity-causing bacteria, feeds on fermentable carbohydrates, particularly sucrose and glucose in processed forms. The bacteria metabolize these sugars and produce lactic acid as a byproduct. The acid demineralizes enamel. This is the cavity pathway. The 1950s woman ate 3 meals at set times. Between meals, her mouth had time to return to a neutral pH. Saliva, which is the body's natural remineralizing and antibacterial fluid, could do its work during those intervals. The person who sips a flavored beverage, snacks frequently, or has a piece of candy at irregular times throughout the day never gives the oral pH time to recover. Cavity formation is not primarily a hygiene failure. It is a pH management failure. And pH management is largely a diet and timing question. This is why the 1950s woman with a simple toothbrush and baking soda had teeth that lasted longer than many people today with electric toothbrushes, specialized toothpastes, and water flossers. She wasn't bathing her teeth in acid all day. The rest of us often are. Habit 4. Water as the default drink between meals. This connects directly to what I just explained, but it's specific enough to list separately. My grandmother drank water between meals. Not juice, not sweetened tea, not any flavored beverage. Water. Water is pH neutral, approximately 7.0. It doesn't feed oral bacteria. It doesn't produce an acid challenge on enamel. It helps flush food particles from the oral environment. It supports salivary flow. Adequate hydration is directly linked to saliva production, and saliva is the mouth's primary self-cleaning and remineralizing mechanism. Fluoridated tap water in municipalities that had introduced fluoridation by the mid-1950s provided a low-level continuous exposure that supported enamel mineral density. The shift from water to flavored beverages as the default between-meal drink is one of the most significant changes in oral health behavior since the 1950s, and one of the least discussed. My grandmother did not drink diet soda, flavored sparkling water, or sweetened coffee all day. She drank water. Her enamel was never under sustained acid challenge between meals. Habit 5. Flossing, but correctly and consistently. Flossing existed in the 1950s. It was simpler. Unwaxed silk or nylon thread. It was used consistently. What I found when I researched my grandmother's habits is not that she flossed differently from what is recommended today. She flossed correctly, which is different from how many people floss. The correct technique, as documented by the American Dental Association, the floss wraps in a C shape around each tooth and moves gently under the gum line, not just snapped through the contact point between teeth. Snapping floss through contact points removes food, but does not adequately clean the subgingival space where early gum disease begins. My grandmother flossed every evening, one tooth at a time, methodically, with a clean section of floss for each tooth. This takes about 3 minutes when done correctly. It feels slow. It is also the single most documented intervention for preventing interproximal decay and early periodontal disease. The water flosser is a useful addition, but not a replacement. The mechanical contact of floss against the tooth surface and under the gum line produces a cleaning action that water pressure alone does not replicate. What the dental product industry replaced. I want to be direct about something because I think it's worth naming. The oral hygiene product market in the United States is worth approximately $14 billion annually. It has grown every year for the past 3 decades. The product range has expanded from toothbrush and toothpaste to electric brushes, water flossers, tongue scrapers, oil-pulling products, charcoal toothpaste, whitening strips, whitening pens, remineralizing serums, probiotic lozenges, and more. Population-level cavity rates in adults have not declined proportionally. The reason is that most of these products address the surface, the enamel, the visible tooth structure, without addressing the underlying conditions that make teeth vulnerable. Diet patterns, snacking frequency, mouth breathing, dry mouth, chronic acid exposure from beverages. The 1950s woman had a toothbrush, some baking soda, some floss, and oil. Her mouth was not exposed to acid all day. She ate at mealtimes. She drank water. Her saliva had time to do its job. The product industry did not make oral health simpler and more effective. It made it more complicated and more expensive, while the fundamental inputs that actually determine dental health have gotten worse. The 4-minute routine costs nothing. My grandmother's teeth at 81 are the documentation. Habits 6 through 10, the complete framework. Habit 6, no eating after brushing at night. The final toothbrushing happened after the final meal of the day. Nothing entered the mouth after. Not a snack, not a sweetened drink, not a piece of candy. This ensured that the mouth went into the hours of reduced salivary flow during sleep with minimal bacterial substrate available. Salivary flow drops significantly during sleep, which is why what is in the mouth at bedtime matters disproportionately. Habit 7. Nasal breathing as default. My grandmother breathed through her nose. This sounds trivial until you understand what mouth breathing does to oral health. Mouth breathing reduces salivary flow, increases oral pH acidity, dries the mucous membranes, and creates conditions that favor the proliferation of cavity-causing bacteria. The 1950s woman who breathed through her nose and slept on her back was protecting her oral environment throughout the night in ways that no product replicates. Habit 8. Chewing fully before swallowing. Thorough chewing stimulates salivary production, both volume and the specific enzymatic components that begin carbohydrate digestion and buffer oral acids. The modern habit of eating quickly produces less saliva per meal and less mechanical cleaning of tooth surfaces from chewing motion. Habit 9. Diluted saltwater rinse for irritation. Any gum sensitivity, minor oral irritation, or early sign of inflammation, a warm saltwater rinse. Sodium chloride solution is mildly antibacterial and anti-inflammatory, reduces swelling in soft oral tissue, and temporarily shifts the oral pH in an unfavorable direction for bacterial growth. This costs pennies. It is what oral surgeons recommend after procedures because it is genuinely effective at reducing soft tissue inflammation. Habit 10. Regular dental visits without avoidance. My grandmother went to the dentist twice a year, not because she was anxious about her teeth, because she was not. The routine was established and maintained as simply what you did. Early intervention on any beginning cavity or early gum issue is the difference between a filling and a crown, between treating gingivitis and treating periodontitis. The most expensive dental work is almost always delayed dental work. What I actually do now. I want to be specific because I find specifics more useful than principles. Every morning, oil pulling with a tablespoon of coconut oil for 10 minutes while I make coffee. Tongue scraping once before brushing. Baking soda 3 mornings a week, plain fluoride toothpaste the other days. Every evening, flossing correctly before brushing. 1 section of floss per tooth, C-shape around each one, under the gumline. Nothing in my mouth after the evening brush. Water as my default drink throughout the day. No sweetened beverages as a rule. I have been doing this for 10 months. I am not going to claim specific results because dental health changes slowly and my observations are not a controlled study. What I will say, my last 2 cleanings have had notably less buildup. My hygienist asked what I changed. I told her. She said the oil pulling and baking soda combination was something she'd been recommending to patients with buildup problems for years. The routine costs approximately 4 minutes a day and about $2 a month in consumables. My grandmother's teeth at 81 cost her the same. 10 habits. All of them either free or close to it. Oil pulling to start the morning. Baking soda for cleaning. Tongue scraping before brushing. Water as the default between meals. Flossing correctly. C-shape under the gumline, every tooth. Nothing after the evening brush. Nasal breathing as default. Thorough chewing. Salt water for any irritation. And regular dental visits without avoidance. The 1950s woman did not have an electric toothbrush. She had a system. The system was based on managing the conditions in which teeth either stay healthy or don't, not on treating the surface without addressing the environment. Tell me in the comments, do you oil pull? And if you've tried the baking soda, tell me how long you've been doing it, because the timeline seems to matter. Like the video if the pH explanation changed how you think about snacking and beverages. And subscribe if this channel keeps finding things that should have been obvious and weren't. She knew. We forgot. Now you remember.